Good morning. My name is Sequoia, and I will be your nurse for today. I will be prepping you for your surgery, explaining the procedure, and answering any questions you may have. You have a type of skin cancer called basal cell cancer. Basal cell cancer is a type of skin cancer that begins in the basal cell, which results in uncontrolled growths or lesions. Your basal cells make more skin cells that will replace the dead ones. Your skin is like a fancy sandwich that has many layers. You can imagine that the basal layer is like the inside layer of the top piece of bread. This layer. Today you will be having surgery to remove your basal cell carcinoma. To complete this, the dermatologist will be using a technique called Mohs. Mohs surgery has come to be accepted as the single most effective technique for removing basal cell carcinoma and squamous cell carcinoma, the two most common skin cancers. This technique is used for sparing the greatest amount of healthy tissue while also completely removing cancer cells. Cure rates for basal cell carcinoma and squamous cell carcinoma are 98% higher with Mohs. This is a lot better than the rates for standard removal methods. For this procedure, the dermatologist will draw around your lesion with ink and then inject a local anesthesia. The dermatologist will then use a scalpel and remove the cancerous skin. After this, a nurse will bandage your wound and you will wait in the waiting room while a technician tests the tumor. If any cancer cells are found when they test the tumor, they are pinpointed and will be called back into the operating room. If your anesthetic has worn off, the dermatologist will numb you and the rest of the cancerous tissues will be removed. The first portion of the procedure takes about 10 minutes, and then you will be in the waiting room for about 30 minutes for testing. Depending on the results of the labs, you'll be in the doctor's office from about 1 hour to 3 hours, depending. This procedure conserves the greatest amount of healthy tissue, giving you the smallest possible scar. Once all cancerous tissues is removed, you will receive stitches. It is very important to follow the instructions for wound care to avoid infection, such as limiting your sun exposure and using sunscreen. I would also like to schedule a follow-up appointment to remove your stitches. That is most convenient with your schedule.